Hello and welcome to the fourth and final webinar of the Above Difference birthday series. And this one, it's so hugely important. I'm so keen to hear the thoughts of our guests. I'm a mother of two young women. My own mother was one of the tail end of the Windrush generation who worked in the NHS for 41 years, training initially in midwifery. So it's a subject that's particularly close to my heart and those of the team here. And as you have signed up for this webinar, then you probably have an interest yourself in maternity services in the UK too. And that probably means that you're aware of a number of the issues of culture, leadership that have been raised time and time again in the reports that follow those tragic outcomes for families and babies in trusts across the country. And you may be aware of the ongoing work of Donna Ockenden. You may also be aware of the very particular disparities in outcomes from individuals of Black and minority ethnic communities, highlighted, for example, in the Embrace report that says that as a Black woman, you are still 5 times more likely to die in childbirth than your white peers. And the Invisible report, which highlights the often distressing experiences of Muslim women in maternity. And we also know about the experiences of members of the LGBTQIA community in maternity services as well, particularly those with intersectional identities from BME communities. Those outcomes are equally poor. So across all of these reports, there's a consistent theme in the recommendations. And the findings are about leadership and about culture. And so it therefore comes as no surprise that Above Difference is working incredibly hard and successfully in this space. Today, we'll be hearing about some of that work that's been described by at least one of our panelists as transformational. Once again, we hope that this webinar will inform, inspire, and help you in so many ways to think about how the approach the Above Difference uses could benefit your organization and your services and your patients and your users, so we can start to shift the outcomes in the right direction. I'm Marsha Ramroop, IT work in cultural intelligence, and I'm not just proud, but it's a true honor and privilege to be associated with Above Difference, who is the leading provider of cultural intelligence solutions to the public sector in the UK. I have my modest CQ competency in organizational inclusion strategy. It's called Unheard Voice, and I'm your facilitator this afternoon, but your host, celebrating 5 years of the Above Difference CEO of Above Difference, Jennifer Izekor, the amazing Jennifer.
Oh, thank you, Marsha. Thank you so much. And it's great to do that. This is the last one. I can't believe it. I was just saying to Naima earlier that when we set out to do 4 webinars in a month, we thought it was slightly crazy idea. But we are doing 4, and this is the final one. And I'm really excited about this. And isn't it interesting, Marsha, that actually I never knew that your mom trained as a midwife as well. And mine did. Mine was also in the NHS when I was born in the 60s. And she was a midwife, very proud midwife. I still remember her going back to Nigeria with her little blue box, which we all thought was very sacred, and there were sorts of interesting things in there. So yes, I grew up around a midwife, and the smell of Dettol, I don't know if that was a thing for you, but yeah, Dettol was a thing.
Isn't that all Caribbean and
Dettol was
families?
Yeah, Oh yeah, so but it's incredible, like you said, this, and all the webinars we've done on policing, on the NHS, on Black and minority ethnic leaders, they've all been important. But this one's pretty close to my heart as well. And I think as a mom like you, and having had the opportunity to do some amazing work with our panelists as well, this one's one we're really pleased to do. So welcome everyone. Really honored, Rosemary and Vicky, that you gave up your time today to be part of this. And as usual, Marsha, you're amazing. Thank you for being here.
Well, I'm delighted to be here, and we'll all be with you till about 4:30 today. We have got the Q&A facility open, and I do encourage you to use that to put questions for panelists in there, which we'll answer during the session perhaps, but certainly later on. So feel free to pop your question in there at any time. If you'd like to keep that anonymous, of course you can do so, but do put your name in there if you wish as well. The chat box is also open to say hi, to recognise your friends, to make any other comments and observations, which I may refer to, but the main purpose is to share your thoughts with other attendees, and the Q&A is for questions for the panellists. Feel free to take a screenshot and share on social media that you're with us and some of the insights that you're going to hear, and please use the hashtag leading difference differently and tagging @AboveDifference. So, as I mentioned, we're here with two exceptional guests. I'll let them introduce themselves, Victoria Cochrane and Rosemary Idiaghe. Victoria, if I could start with you, if you can tell us who you are, which organisation you're from, and how you've come to be working with Above Difference.
Thank you, Marsha, and thank you for having me here this afternoon. So, as you have said, my name is Vicky Cochrane. I am the Divisional Director of Nursing and Midwifery at Chelsea and Westminster in central London. I have a big division, so I have maternity, gynecology, neonates, HIV, sexual health, sexual and gender health. And I also have a role across Northwest London as one of the co-chairs for our local maternity and neonatal system. And now I have to think. I think 2 years ago, I heard Jennifer speak and thought, wow, I need to get to know this amazing woman a bit better. And I am going to chance my arm, because I am also the midwifery voice on the British Intrapartum Care Society. And one of our plenaries at our yearly conference was around cultural inclusion. And after much going back and forward and, yes, squeezing the maternity piece around, we're mothers, we're midwives, all of this, we were very, very lucky to have Jennifer come and speak at the conference. And then, from the London piece, which Rosemary and I sit on the London Leadership Forum, when the question came up about what more can be put in place for us as leaders, with Kate Brentworth, who was our regional chief midwifery officer at the time, we were very strong in our view that we wanted to do the Above Difference masterclasses and go further, faster as leaders in our understanding, in our ability to sit in our discomfort comfortably, in having colleagues challenge us and us challenge ourselves. So just a quick snippet around the sort of last couple of years.
We'll very much look forward to hearing about all of that. Rosemary.
Thank you very much, Marsha, and good afternoon, everybody. Firstly, happy birthday, Above Difference. You're really, truly doing difference differently, so well done. Really, really amazing to be here, and thank you so much for having me. So my name is Rosemary Idiaghe. I am the head of midwifery at University Hospital Lewisham, which is part of the Lewisham and Greenwich NHS Trust. And I'm delighted to be part of the celebration this afternoon. I was privileged to be part of the initial cohort on the masterclass, as Vicky has just elaborated. Our then regional chief midwife for London, Kate Brentworth, very successfully won a bid to start this program. And really, it was a testament of her tenacity as a leader, recognizing what we as heads of midwifery and directors of midwifery really need to equip us to support our teams and also to lead from a place of cultural intelligence and inclusivity. So, of course, when that opportunity came, it's one of the first people to say, yes, I want to be on that leadership program. I'd heard Jennifer speak as well at our one of our London heads of midwifery and directors of midwifery forum. And I thought, just like Vicky, yes, I absolutely want to hear more. And also to understand how I can play my part in supporting colleagues, in leading transformation, and of course, relying on the wealth of human resources that we have within the NHS, which is our people. So how do I, as a leader, equip myself to play my part in leading inclusively? And that, for me, is what Above Difference is all about. So really, really happy to be here, and thank you for having me.
Well, we really very much look forward to hearing about all of those things from you shortly. Jennifer, this is the final in the series, and you've just already heard just a snippet of how important the work has been that you've instigated and developed and delivered. And across all of these, you found all of them very, very important, and I've heard the stories about the transformation that the Above Difference has made, but this one is particularly close to your heart. So how is it that Above Difference has ended up in being involved with maternity services in particular?
You're absolutely right. It's a very important one because my mom was a midwife, and we lost her in 2020, and I remember thinking around 2021 what I could do just to honor her memory. And so I ended up having a great conversation with someone who will be well known to Rosemary and Victoria, Wendy Olayuola, who works in the national unit and has really done a lot of amazing work in this area in her role. And she had invited me to speak to, I think it was a Nigerian nurses, so it was quite a big one of those online conferences. And it became quite clear to me, being able to talk about cultural intelligence then and building links with Marsha Jones, who we met last week, that actually there was something that this model could offer in terms of looking at how we address the leadership issues within this and the culture areas issues. And so at the time, I was fortunate enough to work with the national team as part of a 2-day masterclass, and leading on from that was able to then link in with people like Kate Brentworth, who was then the regional chief officer for London, and some others. We've done work in the east of England. And what's clear to me is that the cultural intelligence model merged with that inclusive leadership model has lots to offer in terms of helping leaders across maternity services who are working across not just a diverse range of cultures in terms of ethnicity, but also in terms of the multidisciplinary services that fit underneath that. And you heard Vicky just now talk about the very broad breadth of services that fit under her remit. And I know it will be the same for Rosemary and many of their colleagues. And I've been really, really happy, actually, I think is a word I'd use, to see how bringing that model to the leaders, they've just, especially the leaders across capital midwives have absorbed it. They've been able to really take it in and use it to their advantage. And I think that, seeing some of the developments and hearing some of the stories that people have shared about how they've been able to use it, I think has just been something that we felt we had to celebrate as part of this. And there's lots of work to be done in this area, absolutely. So this isn't about any, silver bullets, but I think what it does demonstrate is that we can make a difference.
Well, celebration 5 years. This is the final webinar in this series. Tell me your reflections, though, of 5 years at work, doing this kind of work.
Oh, wow. I just think it's, I feel incredibly blessed because, I get to work, I was doing it this morning with some amazing doctors from across Northeast London, Foundation Health Trust. And I think getting into a room with people and actually seeing what we call the light bulb moments come on. And then literally afterwards, Vicky and I were speaking about a week ago, and she was talking to me about, things that she'd done differently because she'd learned that stuff. And that just, it feels like so amazing to be able to do that. Cultural intelligence is a huge part of what we do, but we know it's about leadership. We know it's about inclusion. We very much approach this with a much broader perspective. So we're not just looking at race, we're looking at all the protected characteristics, seen and unseen. But actually that allows us to create spaces in which people really engage in those discussions and learn from them. And I just think it's an absolute privilege to get to work with people like Rosemary and Victoria. It really is.
Well, speaking of Rosemary and Victoria, I just saw you nodding along with the light bulb moments, etc., that Jennifer just described there. Victoria, if I can start with you and ask you about, your experience of the leading and engaging inclusively with cultural intelligence. It was a bespoke program that Above Difference put together for you. Tell me a bit about your experience of being part of the program, Victoria.
You know, when you've been doing this as long as I have, you've been on many, many programs and many masterclasses and many days. It's probably the only time where we've got to the end of the day and I've thought, I'm not ready to go home yet. I need to ask a few more questions. And I genuinely mean that. And a lot of it is down to, and I have done a lot of anti-racism, cultural safety, you know, LGBTQ plus competency. And the gift is in feeling, Jennifer makes you feel safe enough to be able to feel uncomfortable and ask the questions that give you the understanding about how you're going to lead differently and lead all of your people. And that, I think, is some of the biggest light bulb moments for me. The bit around, that's why the theatre staff won't speak up. No matter how many times we say, if you see X or Y or Z happen, use your voice, have your voice. But then to go back and in a way really understand high-powered countries, low-powered countries. Maybe somebody in that team has spoken up before and actually was squashed back down again. They'll never speak up again. So we really need to think about how we intentionally go about it differently. And again, and again, and again. And you know, all of our leadership team now have in the front of every diary that they have now, the culture is set by the worst behaviour that a leader allows to go unchallenged. Because at 6 p.m, when you're tired and you're onto your 4th report and you hear something outside and you think, you look to the front of your book and you think, okay, and that, I think, to me is the difference with above difference, is that it really brings it back to each individual intentional thing you do or you don't do is steps on your journey.
Setting the culture. Thank you, Victoria. Rosemary, when you listen to that, clearly it's resonating with you as well. What was your experience of the program?
Absolutely, totally does resonate with me. Thank you, Marsha. I think for me, really, Above Difference Masterclass has been a true eye-opener on many levels. We know what is said about leadership and how everything rises and falls with leadership, and how leadership is at the heart of any transformation work that we want to put in place within any organization, and particularly within maternity services, as we've known of all the mishaps and all the challenges that we face. You want to talk about recruitment, retention, the multiple reports and scrutiny that maternity has been under over the years. Leadership remains at the heart of those reports, and also the recommendations for those services to improve. So I think for me, Above Difference really cuts at the heart of what leadership really is all about, on the facets of leading inclusively, leading all people well. I think that runs through the fabric of the masterclass. I think also for me, it's also about understanding my privileges, because when we talk about privileges, it's only a limited number of privileges that one knows, but as a Black woman as well, I got to understand that I do have some privileges as well, and it's about recognizing those privileges that I have as a person, as a woman, and also using that to be empathetic and compassionate to my colleagues as well, and recognizing that all of my colleagues may not be in the same position or situation that I am. So how am I able to use my influence as a leader to lead all people well and support them appropriately? And then when I think about how I'm able to transcribe that leadership into the work that I do as a head of service, I think about it from a business perspective. You know, when we're investing, for example, in our people who are our greatest resource, always touching base with our colleagues, making sure they feel valued, because one wants to demonstrate that interest and also that understanding of what matters to our colleagues and what they require to enable them to thrive. So I think Above Difference has opened my eyes on many levels, and I think there isn't any end to what's the learning that Above Difference can deliver. And I think it's also important that that's understanding and what I've gained from the program is shared across to my colleague as well. So it's been a huge benefit for me, definitely.
Victoria, I saw you nodding your head there as well, and I think that idea of that transformational leadership, then actually delivering a kind of change in behaviours, not that only that you can role model, but that your colleagues can role model as well. What sort of feedback have you had from your colleagues and those you're working with about how they've seen you change, or your attitudes and your leadership change as a result of doing this?
So that's an interesting one, and I think our journey from a Northwest London perspective around cultural safety, so different, but some of the same, started a while ago. And I suppose the big additional add-on since doing the programme is around the confidence in both the reach, so how we make sure the reach across the system is the same, and the equity piece around it's not okay for one of our services to be doing this well. We need to, you know, make sure this happens in all areas. But it's the small things, it's the staff who might not have come to you before that will come. But it takes time, doesn't it? And Jennifer's always very clear in it's a journey. And I have days where I feel a little bit frustrated because, you know, I am maybe not the most patient woman in this world. And taking that step back and thinking, okay, you know, to me, it feels like the bit around leading all people well will take time for them to see that you are leading them all well, because actually we have a lot of people to lead and to feel valued, and it's each of the steps in the de-bias and the recruitment and being very clear and pronounced in how you put that out. And it's each of the steps in being intentional that this year we're not going to be able to celebrate everything, but we're going to celebrate, for example, Ramadan and Eid really well, and we're going to take the time to do that and do that well. But actually we might not get to everything, and so there will be some of our people who come and say, well, you know, why did we not do this? And you can hear their frustration, and taking the time and being able to articulate the why. I feel much more that my skills, the skills I have been given, allow me to talk through the why and the place in the journey.
And certainly it sounds like the skills that the programme has provided you with are just so much broader than just simply looking at inclusion or aspects of cultural intelligence and inclusion. It's just been a whole bigger piece. And just I've written down something that you've almost said, and I'm pretty sure this is what you've meant, is that culture is the small things. Culture is the small things, that those incremental changes that make a difference for every life that you touch, be it someone that you are serving as a patient or one of your colleagues. Yeah, I like that. I'll attribute that one to you. Rosemary, you know, you were also you know, feel that this is something, I'm sure that you felt that kind of transformational change as well. How would you describe those broader skills that you've been able to adopt and develop as a result of working with Jennifer and the team?
Yeah, thank you, Marsha. I think before I go on the broader skills, I just wanted to point out again that with Above Difference, that focus on the small things. I know Vicky talked about culture being small things, but also it's about what truly resonates with our colleagues. And this is our colleagues at every level of clinical work or leadership work. What matters to them is seeing us as, first of all, a human being, that they can relate to it, that can understand and can communicate effectively. So those basic things, and with above difference, enhancing our broader skills of communication, knowing how to communicate effectively at different level. I remember we did a role play about how we sort of modified the way we relate to our colleagues based on their different cultural background and knowledge about things around them, and how it enables us as leaders to be empathetic, to be supportive, and how we also show that commitment to supporting them all the way through. It can be a little bit, as you know, Vicky's alluded before, frustrating or tiresome, but these are actions that are deliberate, that are somewhat must do for us as leaders to ensure that our colleagues feel that they are being listened to, that they are valued, and also that they are in an establishment or in a service that cares about their needs as well. Another broader skill, I would say, it's about listening. I know we talk about communication and how we speak and our body language, but it's also about listening. Sometimes those richer, bigger skills of just paying attention to the body language, paying attention to the emotion that comes out of our colleagues after a day of hard work and, you know, short staff and very busy clinical areas, having that opportunity to just sit down and hear them. Sometimes it's just what is enough to make them feel that they are able to go back home to their families and, of course, come back another day. And I think, again, what above difference helps us to, or has helped me for sure, to also recognize is that I can't get it right all the time. And also being able to hold myself to account in some ways and ask for help, and also broaden my knowledge and be less wrong in the things that I thought I knew before, and reaching out, exploring, examining the way that I lead as a leader and thinking about it critically, and having that understanding that sometimes the way we do things all the time, expecting to have a better result might not be the right way, but also appreciating that there's always an opportunity to do better, because running a service that is safe is incumbent on us going back into the drawing board and looking behind and saying, who is following me? And as Jennifer will say, who is coming on that bus? If we don't have followers, then we're not leading, and we're not leading well.
Yes, Jennifer, when you listen to that and you know, over the last 3 webinars, we've been speaking about this unique approach that you have above difference. We know that cultural intelligence sits at the heart of that, but, you know, there is so much more, that listening piece, the coaching, the other tools. You know, what was your thinking in developing the program for the maternity services? And why do you think that it has made that significant impact that it has for the leaders who've undertaken the program?
Well, you know, Marsha, we both, you know, are very committed to the cultural intelligence model and are using it in different environments. But I think what I was fully aware of, and it's been the same with all the work we've done, was that as great as the model is, when it comes to addressing the very real issues around inclusion and equality, we needed to wrap it around a number of other things. And what you've heard both Vicky and Rosemary talk about is that emphasis on leadership. You know, and that inclusive intent, what we call the intentional inclusive leadership, and what that actually looks like in practice. So I knew that that was an area, because that had been flagged in, and having read some of the reports and the recommendations that had emerged from those reports, there was a real sense that leadership at all levels, and not just leadership in terms of those who held the titles of leaders, but actually how you looked at leadership within all levels, and how you moved from an approach that was very much about managing the diversity problem to leading for inclusion. And that's often a question I ask leaders, well, which of the two are you doing? Because I think what you've heard both Vicky and Rosemary talk about is an approach that's now very much about intentionally leading for inclusion, as opposed to just where we've tended to be in the sector, across the public sector, where we're managing the problem that is diversity. So getting people to see that the opportunities within that was very much at the sort of heart of what I wanted to do. I often also say that we never go into an organization or work with colleagues like this on training courses. For us, it's a journey, and we're still on that journey. Actually, we're coming back together, I think, in a few weeks' time. So there was that emphasis on bringing the skills to people and bringing the knowledge, the model itself, but then really having those in-depth conversations about how do you apply this? What does it mean for your everyday role? And how do you take responsibility for shaping cultures? And, Vicky, gave me a really great example, and she hasn't mentioned it yet, but just an example where she saw something happening, and whereas before she might have been too tired or distracted to actually address it, she actually went out of her way to address it. Because again, that thing of, if you don't, what your inactions and your actions as leaders can speak volumes. And I was very conscious of the fact that these are leaders who are working in the most hectic environments, in fact, environments we possibly can't imagine. So I think at the heart of the program that I was looking to do was to bring all of those models together. And the final bit of that jigsaw puzzle, which is where we're working on now, which is how do you then lead and manage change effectively? Because we know these services need to change. We know that cultures need to change. But in order to get people, Rosemary just referenced that, I call it the bus, getting people on the bus thing. In order to get people on the bus of change, you have to know how to understand the various cultures of the people you're trying to connect to in order to get them on the bus. And that's where I think we take the cultural intelligence model and really flex it into giving leaders the skills to begin to identify how they equip and take people on that journey of change. And I think that I hope is one of the things that will really make a big difference.
I'll talk to Rosemary and Victoria in just a moment about the impact on patient care, but if I may ask you, Rosemary, about that, when you look at, I know it's the next piece that you'll be looking to do about that change piece, it is even a cultural shift to move from managing diversity and all the disparate initiatives that might be looking to try to do this work, to actually asking people to look at behaviors and doing that leading inclusively piece different. So how have you managed to create that shift, or how have you observed that shift with those who've been doing the program with Above Difference to try to change from looking outward, if you like, to looking inward?
Well, our clinicians have
Thank you, Marsha.
become planted on the use
Can you hear me?
Yes.
Okay, sorry, my background is a bit noisy. So for me, really, it's about the impact of leadership and taking leadership very seriously, as we talked about how everything rises and falls with leadership. It's about recognizing the impact that it creates and the influence of that power that comes with our position as leaders, and of course how that is filtered down into the people that we lead. And it's also about how we are stronger as leaders by giving off that power, if you like. So basically ensuring that teams are aware of what our vision is as leaders, what it is that we're trying to achieve, and also ensuring that that vision and these values are communicated effectively across all parts of the service. Sorry, I'm going to stop speaking because there's noise in the background, so I'll put myself on mute. I'm so sorry, Marsha.
Thank you, Rosemary. No, I think we've got some of your thoughts there as well, and that power piece with the leadership, the authority that is held with the leadership, and the vision that they're really able to clearly articulate to those that you're working with. And Victoria, when you think about that shift as well, because it is quite a significant one, when we're thinking about that inclusive piece and leading inclusively, it is a shift for everyone we're working with to think, oh, suddenly I'm not looking outward, I'm not managing diversity. That will be a great outcome once we get that leading with inclusion piece right. It does filter down. How have you been able to communicate that to those you're working with?
So now's really quite a powerful time in maternity. because we have this year had our 3-year single delivery plan. And it's been really, I mean, I feel incredibly blessed because not only was I able to go on the programme, both of my, the deputy directors of nursing and midwifery that I work with were also able to go. So actually 3 minds inward looking, thinking about all of this together actually has been incredibly helpful. And, you know, as Jennifer and Nima will know, for me at the end of the first day, I was very much, well, we need to do more of this, and we need to have more of our teams come on this, because I can't talk to this the way you can talk to this. And, you know, some of it I'm willing to try, but actually it has to be shared and delivered by the right people with the right skills, with the right knowledge. But actually what it has really made us stop and rethink is, where are the decisions made, and who's not at the table when the decisions are being made, and who do we need to make sure knows they have a seat at the table, and how are we going to rethink what the table looks like and where it is and what time of the day it's at. And, you know, our original, you know, NHS, how we're going to do our next 3 years worth of our strategy to achieve the single delivery plan has completely changed. And yes, I know what my vision looks like, and it's again within the book and the bus and where the bus is going and who I'd love to get on the bus and what that destination looks like. But the bit around making sure that everyone else wants to get on the bus because the bus is the right size, or maybe it's not a bus, maybe we're all getting in a Porsche and we're off to the Maldives, because that is what this new wonderful place looks like, although I'm not sure if I've got the money for the holiday to the Maldives. But my point is, we've, instead of something that would have taken us 2 to 3 months to turn around and land, it's going to take us 6 to 9 months, because there will be a huge number of focus groups and engagement events that have been really well thought through in terms of how they're delivered, when, where, who, you know, how do we make it safe? How can people share anonymously or with their, you know, the things that I never thought about, I spend a lot of time thinking about. And I think that has been the true magic. It might take us longer to get to the Maldives or the beauty of the single delivery plan, but what I really hope when I look back, the whole team will be able to say they have been part of it. And for those who weren't, that they know they could have been, and at many points could have shared what was important to them or how we go about it. Because it's interesting, at the start of this, everyone's talked about the reports and the worst outcomes that we see in maternity. But they're the worst things that happen. And underneath that are the admissions to the intensive care unit, are the birth and women and people that don't have the birth they'd hoped for, are the complaints that we don't get, because actually people don't feel it'll make any difference. There's you know, a lot of the outcomes we talked to in the Ockington report and the report from Morecambe Bay and the Embrace statistics are the absolute worst. But the number below the sea and the outcomes below the sea of just people not being heard is far-reaching.
We'll talk to that point, and just before we get there, though, I am curious to know from you, how important is it that when you do these sessions with Jennifer and Above Difference, that you do have colleagues with you when you're actually you know, hearing the message that Jennifer's delivering?
So I think being a director of midwifery or a head of midwifery in the UK right now is probably the hardest it has ever been. So having first of all, a space to come together as leaders is incredibly important, and coming outside of our organizations to do that. And then hearing it all together and understanding the direction that we're all moving towards, and being able to help each other, because we pick up the phone all the time, and some services will be 2 steps further forward than another service, or Rosemary may have tried something that worked that she can then share with me, or something that hasn't worked that we've learned from together. And I think absolutely being together to undertake this program has been incredible, and which we may or may not get to is also the place from an organizational perspective, the journey we would like to go on at Chelsea and Westminster with Above Difference.
Well, that's good to know. Rosemary, I mean, just to come back to some of those pretty shocking and disturbing statistics around who is affected, how they're affected, some of the worst case scenarios that Victoria Vicky just alluded to. These reports, maternity service is 5 times more likely to die if you're Black in childbirth, and the reasons that you're more likely to reach those aren't necessarily balanced by the fact, according to Marsha Jones in the last panel that we did, that a lot of the staff who are working in maternity services, do they themselves come from the backgrounds that are likely to be affected by these outcomes? So the global majority communities. When you look at those statistics, and they're particularly poor in places like London, how do you think a programme like Above Differences could make a difference on all sides? The staff who are they themselves coming from these communities, and still we can find ourselves with these outcomes.
Thank you, Marsha. And you're right, everyone is affected, including society. From an equity and inequality perspective, the whole nation is affected, and of course continues to transcribe into generation after generation. So it is stark, those reports and those findings, highlighting the disparity in experiences and outcomes of a global majority mothers and birthing people. I think when it comes to how colleagues are impacted on it and how it affects them, I think one of the things really that struck me with Above Difference, it's the tools that it's giving me as a leader, and also other leaders within the NHS, and not just maternity, of course. It's that power of proportionate representation, knowing that every voice counts, and also enabling those voices to be in those spaces where their voices can make an impact and can make a difference. So creating the environment, creating those spaces that enables people to be brought along, to sit at this table, to open up conversations that of course are not easy to have in the first place, but conversations that matters to our community, to our service, to our organization. Of course, we can't say we are providing a safe care if we're leaving people behind, if there is disparity in outcomes and experiences affecting one group over another. That is in safe care because it's pertaining to a certain group of people. So having that ability to enable proportionate representation across all levels, holding our community at the center of the care that we're providing, so it doesn't become tokenistic, it doesn't become just something that we're doing because we have to do it. It becomes something that we're doing because we care, and because our communities, our women and birthing people and our patients matter to us. So that this Above Difference program has enabled me as a leader to expose myself, to present myself with my vulnerabilities of not knowing everything, and appreciating the values and the contributions of my colleagues. Having that opportunity to work collaboratively and harnessing, very importantly, harnessing those voices that we may not even call to the table or bring to the table, but recognizing that they matter and that their contribution is paramount if we are going to focus on delivering safe, equitable care across all of our services. So definitely a focus on proportionate representation is really what Above Difference has exposed me to as well from an inclusive leadership perspective.
And Vicky, you know, those conversations that matter, obviously, a really crucial part of, you know, being able to lead inclusively. But in addition, the point that Rosemary made about the vulnerability of such leadership as well, how has that felt for you? How has that the Above Difference program really helped you to become more vulnerable but
That's a very good question, Marsha. It's actually enabled me to be at ease with it and make peace with it. It's okay. And that is why it's even enabled me to be able to reach out to my colleagues better and to sit comfortably in the knowledge that I can't know it all, and it's okay not to know it all. And also, if I was wrong yesterday, today I'm going to focus on being less wrong than I was, because I have acquired that additional knowledge and information that is around me. And as Vicky said, we work collaboratively. We can bring up a colleague within our service or within our region and across as well, because we know in isolation we can do very little. But as a collective, as a group that is empowered and singing from the same hymn sheet, again, focus on the fact that Above Difference should really come across and, go wider across the NHS. But we're singing from the same hymn sheet. That vulnerability makes me feel actually it's great to be a leader right now, because I know that I am going to be supported by people, like-minded people, who will uphold me and will uphold each other on this same agenda of trying to do better every day.
Yeah.
Yeah, Victoria, your thoughts on that?
Yeah, I mean, for me, there's the vulnerability, but it's the getting comfortable with feeling uncomfortable and asking myself, why am I feeling uncomfortable, and what is it in what I have done that isn't necessarily the right thing for some of the people in a meeting, or the transformation piece that we're trying to move forward with. There's also the bit that I think Above Difference and the learnings helped me with the ability to apologize for things in the past. And that's to help with the trust piece. And where unintentionally the trust may have been broken because something that I unconsciously or potentially consciously have done in the past. And no matter how long ago, once recognized, how you go back and you say sorry for that. And not in a very quick, I am really sorry that happened, but in a, through my learning, through my growth, through my working really hard to lead difference well and all people well, I have recognized that, 6 months ago, with whatever it was, I don't think I got this right. And actually a couple of times that person's moved on and can't remember, but actually for a couple of individuals, it has gone a long way to have somebody acknowledge and truly acknowledge it. And I think I would never have had the skills and knowledge, to know how to go about doing that, or to realize how important that is in being able to be vulnerable as a leader in this space.
Jennifer, that's massive. That is a very significant change in how leadership has been done previously. I think if you think about some of the traditional, if we want to call them modes of leadership training, you might say, well, the leader has to, put on this front of they have all the answers and they're going to, lead from the front. And what Victoria and Rosemary have just described there is, well, dare I say, it's a far more human way of going about leadership, and some people may even say it's a tautology to talk about inclusive leadership, because how can you be a leader if you're not inclusive? And so it's what almost saying the same thing twice. So how does it make you feel to hear these things from Rosemary, Victoria, and what's your ambition for where, just for them and with their teams, you can go next?
Oh, it's amazing to hear that, and in many ways beyond, anything that I could have hoped for. I knew, there were a couple of other things that for me were important, and you probably know this, Marsha, already, that when we look at the inclusion agenda, we look at the whole agenda, and I think that's really important. We don't just come at it from a race perspective or one particular. We're looking at everything, and in many ways, yeah, you're right. It's that human concept. Is that all those intersectionalities? And I think the other thing that's for us is providing a really safe space for leaders to look at this through the eyes of their own humanity. And I think when you bring those two things together time and time again, that's what we're beginning to see, that actually that allows leaders to come back to, for practically every leader I meet across the public sector, the reason they wanted to be leaders in the first place, because nobody wanted to be a leader just to put up with all the data and the stress that comes with it. But it's really because people wanted to make a real difference. And hopefully that's what our model allows people to do. And then you get the cultural intelligence bit that gives people actual, hardwired tools, tangible tools. And so what you're looking at there is your CQ strategy, your CQ knowledge, how suddenly you begin to expand the use of those tools to get people understanding. Someone said just now, I think it was Josephine, I love the bus example. When I talk about the bus example, I always say to leaders, imagine you've got this yard full of different groups of your staff all around, and we've got this lovely inclusion bus, and we're saying to everybody, get on the bus. It's inclusion, it's good. Inclusion's good, bus, everybody get on the bus. And then you've got a group over there going, well, I'm not sure I like buses. Just get on the bus. And a group over there going, well, who am I going to sit next? Get on the bus. So basically what we're generally doing is say to everybody, just get on the bus. It's the inclusion bus, must be good. And actually, if you don't want to get on the bus, you must be a very bad person, right? And actually, there are a lot of people just sitting there going, I don't get this. I mean, is it just for the Black people? Is it just for those people? What about me? Am I part of this? Is it why bus? Could we have a Porsche instead, like Vicky says? And so you've got all of that. And actually, what CQ allows you to do is then begin to say, actually, how do I understand the culture of each of those groups? How do I get what's important to them? How do I understand their pain points, their values, their norms? And how does that inform my strategy of engaging with them? So actually, you might be going to one group and saying, listen, they're really comfortable seats on this bus. You get on, you're going to get ice cream as well. And actually, that may get some people on the bus. And you might be going to another group saying, you get on, you can sit at the back of the bus if you don't like the front. And I think it's how we have much better conversations around the inclusion agenda, conversations that leaders feel able to have, conversations that engage everybody in this agenda. Because I tell you something, I suppose the value that sits at the heart of everything we do, and I truly believe this, inclusion has got to be about everyone or it becomes about no one. And that's the truth of where I think we all are. And we can beat certain drums hard enough. But if we don't bring everybody with us, as Rosemary says, then we just aren't going anywhere. Anyway, the bus isn't leaving the yard. And so for me, it's all about how we equip leaders to get that bus moving, to get us moving. And it's not a short journey, it's a long one. But, it makes me really excited, and particularly in midwifery, because I think, you're looking at very hardworking people delivering on on many people, on birthing people and families and women at one of the most vulnerable times of their lives. So if we can equip leaders to have the skills to be more confident, like we've just heard, then for us, yeah, that's something to celebrate. That's a lot to celebrate.
A lot to celebrate, literally around giving life to new generations. It's important, it's done well, it's done inclusively, it's done compassionately with the humanity that we would want our services to provide. And it certainly sounds like that has been a journey that your colleagues here have been on. And when there's something there that Rosemary and Vicky that Jennifer said about leaders looking at things through their eyes of their own humanity. And you're nodding your head. I mean, Rosemary, I don't think any any leader in the NHS would like to believe that they're leading without humanity. But there is something about this model, this working with above difference, which I suppose emphasizes that for you.
So true, Marsha. No leader within the NHS wants to lead without humanity, but sometimes the humanity can get lost in the day-to-day mundane activity, spreadsheets, business cases, reports that we are having to contend with. And also the complexities within our services, and this is across the NHS, sometimes unintentionally that humanity is lost. But I think it's also about us recognizing that we can always come back to the drawing board, come back to basics. And I think what I found for myself and my colleagues, they can be very forgiving to welcome you back and show that compassion back and say, I know you've had a hard day. I know it's difficult being a leader. Sit down and let's have a cup of tea. So I think it's also about reaching out to our colleagues for strength, for that support, because together is how we are stronger, as I've said before. And not feeling embarrassed, which I have done in the past before, feeling embarrassed about our vulnerabilities and how we sometimes don't get it right as leaders. It's okay. It shows who we are as who I am as a person, my authenticity, my true self, and also recognizing that I can learn and I can be better, which of course I think invariably informs my colleagues as well, my direct reports, those that I'm leading, and make them think, well, if Rosemary can get it wrong and try and do better, of course, that is permissible. And as we're talking about patient safety, looking about patient safety incident response framework that we're all talking about learning, it makes it now natural and normal for us to raise our voices, for colleagues to call out things that haven't gone wrong within healthcare, within maternity. So providing that safe space for people to speak up, because it is permissible. Their leader has demonstrated that it's permissible to speak up. You have that psychological safety for speaking up when things haven't gone wrong, recognizing that there is nobody that is fallible or infallible, beg your pardon. We are all prone to making mistakes, but it's having that psychological safety to reach out, to speak up, and also knowing that we will be supported as well. So again, everything rises and falls with leadership, and we set the pace. We as leaders set the tone, and above different equips us with that knowledge to be able to do so, and also the skills that we require to make it a continuous process of improvement.
Just a reminder to our audience, if you have any questions at all for our esteemed panelists, please put them in the Q&A box. I'd like to introduce you to Naima, our colleague with Above Difference, who's been looking at the chat so far. Naima, are there any questions for our panelists?
Yes, so we have one from an anonymous attendee. He or she says, I am a B7 cultural liaison midwife in a new post. I am already facing resistance from my own managers to the idea of addressing the issues of racism. They want any discussion to be sugar-coated so as to not make people feel uncomfortable. How do you suggest that I bring those above as well as below along into a place of being willing to sit in that place of discomfort so that true discussion can take place on how we can change? What are your thoughts on the terminology around racism in the NHS? I think that's another question. I want people to take their blinders off, but I am struggling to know how to bring people along, especially my superiors. I work in a trust where 100% of our midwives are white women, 10% of our women are of ethnic minority. Fully loaded questions, a lot to unpick there.
Yeah, so the first question really is about sitting in the discomfort of being able to discuss some of these really quite thorny issues. As Jennifer already alluded to, the above difference model encourages an intersectional approach, but to speak, we can't ignore this quite big issue of race in the NHS and racism. In fact, we spoke about it on one of the other webinars, and I would encourage people to go back and look at that. But what are your initial thoughts, Vicky, and Rosemary, on that question? How do we encourage, especially superiors, to sit in their discomfort around acknowledging how race might be playing a part in decision making?
Yeah, so the first bit for me to, from a practical perspective, help support the person who's asked this question is, this post was created for a reason. And this post comes with a job description. And actually, if what this post holder is trying to do is follow through in the roles and responsibilities set out in this job description, then, going back to who their direct line manager is, their head of midwifery is, their director of midwifery, and saying, I need your support, others' support, to be able to, take steps forward with this. Also, maybe thinking about who within the wider trust, is there many trusts have an equality, diversity and inclusion manager for the trust, or inclusion lead for the trust. So thinking about where staff, where this member of staff might get support from, and thinking about the steps that they, what processes might they use when racism comes up, homophobia comes up, whatever it may be, from a service user or a member of staff's protected characteristic that is the issue at play here. The question you asked, Marsha, sorry, how do you get comfortable sitting in your discomfort? I think it does take time, and I think some of it is because of the historic training education programs that have happened that haven't been about inclusion. There has been, put 30 white people into a room and tell them all about the white privilege and how bad that is, and the atrocities of the past, which there are very, very many, and we need to acknowledge and understand before we're able to move forward from. But I think it has, to my mind, historically shut people down, and then they don't even know how to start having the conversation about how, as a team, people might move forward together, and what steps might we take when somebody isn't inclusive in their language, or there is a microaggression in an area in the department. And so I think the difference with above difference is that, Jennifer talked a lot about, and Rosemary's talked about it, we all have privilege, and and not seeing it as a stick to beat ourselves with, but how do we use it to be more inclusive leaders? How do we use it to support everyone to try and keep taking steps forward to that place of equity, and then ultimately belonging and want to get on the bus or the Porsche or the yacht, and I might have gone round that, but I think some of how this has been done in the past, I don't think has helped people to feel comfortable being uncomfortable. And I think this is the difference with above difference, is thinking about it differently from leading difference, and doing that well.
When I reflect on that question as well, I think there's probably a piece for this culturally liaison midwife around really understanding what their superiors might have been told previously, and to your point, Vicky, about, or what kind of training have they already gone through, what have they been told about what they should and shouldn't say in these things. That there's probably a piece there, and there might be a coaching approach that needs to be taken here to try to understand the perspectives that you need to work with, potentially. I mean, Rosemary, do you have any views based on the recent experiences that you've had around not only getting people to sit in their discomfort, but there was a specific one around the terminology of racism in the NHS?
Thank you, Marsha. I mean, listening to that question, a couple of things came to my mind: courage and also perseverance. And I would say, first of all, to that person who put in that question, not to give up. We've come a long way with racial matters, prejudice, unconscious bias, and the journey to get to where we are started from somewhere, and from our forefathers and for people who have been working in race-related areas for a long time. So I would say to that person, please don't give up hope. And it's okay for your colleagues to feel uncomfortable. That's a good start. That is recognizing that at the end of the day that they are humans as well, and this feeling, what is coming out. But of course, sharing those and also recognizing that is also very important. But I think from a race perspective, I think within the NHS, if I can speak for within the NHS, it has kind of many connotations, and coming from a place of intersectionality, being a Black woman, being a Black woman who is a leader as well. I think it's about recognizing how that influences in our leadership styles, in the way in which we bring our colleagues along, and also in the way in which we are able to inform our colleagues of different races, and also bringing that appreciation and that understanding of our cultural background, if you like, what makes us who we are, our lived experience. And I think that's where quite a lot of trusts have done work on reverse mentorship as well, ensuring that colleagues are able to understand lived experience of their colleagues from a global majority, understanding who they are and how and what influences them as a person or as a people, and how they can work collaboratively with them in the journey, and also in a shared vision perspective. So there is a lot about understanding the different races and the different contexts that brings into leadership as well.
Jennifer, I don't know if you've got any thoughts, but adding to that, another question about how do you deal with white colleagues feeling uncomfortable and complaining about Black and Asian staff having their own platform to support each other?
Yeah, and I'd like to address that and the other question as well, because I think something Vicky said is really important, and it sits at the heart of the way I designed our programs. Because as a public servant, and having been a senior civil servant and worked in leadership, I sat in a lot of those programs that Vicky talked about. The kind of programs where it was just about really getting people to understand the issues of race and race inequality and all of those things. And don't get me wrong, I think those are really important things, but where it comes down to all our humanity is that our natural reaction often to being confronted with things we don't like is to put up the fences and for us to go into fight or flight mode. And that is just a human reaction. In fact, I think somebody said there are three things. It's freeze, fight, or flight. And when people go into that mode, then actually what doesn't happen is there's no learning there. So you may convey all the information you want to convey, but what you're not getting people to do is actually get into that space where we thrive, and the space in which we innovate, the space in which we begin to think, how can we do things differently, has to be a safe space. So, and that's just, again, human psychology. So if you are thinking about this, and I know, you said here you want people to take blinders off and you want people to hear it, or you don't want to sugarcoat it. I think it's that difference. And, it's something we talk about quite a lot in our programs, the difference between communicating to and at people and connecting with people. Because it's when you connect with people that you can actually get change to happen, which then ties into what Rosemary said about when we're more aware of us and more aware of what we're bringing into the picture, then we can form those connections. And when you form those connections, then you get people wanting to come on the journey with you. And so that's what I would advise. And, I might say, you probably would say this, but I know Nema's just put in information about our masterclass on there, leading and engaging inclusively with cultural intelligence. And whoever that's something that you might choose to engage in, see if you can get your seniors to send you on one of the programs. But I think it is really about how you use your own cultural intelligence. And the same comes to you know, if white colleagues are feeling uncomfortable and complaining about Black and Asian staff having their own platform, I mean, there will be those people who are just going to complain on either side. And those I'd suggest don't give it air, don't give it oxygen. But what I would say, though, and this from an above difference perspective, is I think we have to, without undermining or ignoring the very significant issues about race, and believe me, you know, if you've known recently, I've been talking about this a whole week quite publicly about how racism can be a real damaging impacts on the way people behave. But by the same token, I think we've got to take the discussion broader. The NHS is made up of people from so many different backgrounds. Intersectionality is a real thing. And if we are going to get people coming with us on this journey, then we've got to be more inclusive, even in the way that we have the discussions. And we've got to be able to hear each other in this debate, because otherwise we will keep going round in circles. And so that's why I would suggest, you know, really think about your own, what you're bringing into this picture. And I'm not saying this is all about you, but think about how you can connect with the people you're trying to lead on a journey of change in order to get them there. And you know what? Sometimes we do have to coat things in sugar in order to get people to take the next teaspoon, you know. You know, I don't know why this example has suddenly come into my head, but I grew up in Nigeria where the treatment for malaria was quinine. Rosemary will remember this. And if you ever took Neverqueen, the tablets are the worst things you could ever taste in your entire life. For some reason, the quinine was raw, they were bitter, they were awful, you know. And as a child, sometimes, you know, people would put them in honey in order to get you to swallow them, you know. And so I'm not saying we sugarcoat the very issues of racism, but we need to connect with it. You have to decide, are you trying to communicate the problem, or are you trying to connect with people to solve the problem? And that means our approach has to be adapted depending on what we want to do.
That sounds like some very good advice. Naima, there is another question in there, and I'm not doing very well with my glasses, so if you don't mind, Naima, just sharing that third question out loud for us.
Any glasses?
Okay. The third one says, as a midwife, I have been privileged to be involved in recruitment and have seen the discrimination that goes on by certain senior staff for some roles. How do we challenge this type of behavior? White senior leaders influence and dictate to managers who should be shortlisted for certain roles. This is so wrong on many levels. I feel the system hides behind EDI, inclusion panelists. However, for some roles, overt discrimination does still exist. This is demoralizing. I think this is across the board, not just in the maternity services. Recruitment is an issue.
How do we challenge this type of behavior? I've got some thoughts, but I'd like to hear from Victoria and Rosemary about challenging discrimination and favoritism, even nepotism in recruitment.
Shall I make a start?
Go for it, Victoria.
By no means do I think we have this completely nailed, but I am very blessed to work with a fantastic cultural safety team, and we have done lots of work within maternity and now upwards in the trust around de-bias in our recruitment processes, one step at a time. So we have when our jobs go out to advert, we aim to have them all go out externally now. There's no internal, it's fair and transparent and across the board. We try and have either 2 or 3 people do the shortlisting. And we've really thought about what goes into the interview process, knowing that some people love a presentation and are great speakers. Other people are much better at maybe doing a debrief or managing a clinical interaction. Some people are good at interview questions, some are not. What we've started to try and do is have some of the questions as known questions, so that we're not catching people on the hoof. Like, let's see the best that people can bring to an interview by, you know, we're almost up at, for some interviews, 50% of questions being known, so that actually colleagues can go and do their research, making sure that we consciously put out the adverts on all of the different social media platforms, so that it's not just if you're in the know, you'll know that it's on NHS Jobs. It goes on WhatsApp and Facebook, and talking about it when you are walking around to all staff, not just the staff members that you know will come and ask you at the end of the day, could you help them get ready for their interview? Because there is that bit, that's some of what I feel like is in that question. You know, if you're in the know, you'll get the support to apply. And then some of the pre-work to that is around, how do we help all people who want to make the next step have the skills and be ready to make the next step when the role comes out? So we have, you know, some, we've put on workshops around how to write your personal statement, how to prepare to do a presentation. And the uptake is growing as the trust grows and as the intention behind, you know, de-biasing the recruitment process happens. But it will take some time. It will take a long time, and there is nobody, you know, sees and hears and feels it more than me, where we have had what I would say are incredible colleagues consider applying for roles with us, and then when they understand the lack of ethnicity across our trust and our service, they don't want to apply. And I don't want to tokenistically appoint anybody, so I want to grow from within and be really clear and intentional in how over time on our journey we are going about doing things differently.
Yeah.
Rosemary, just your reflections on the recruitment systems, but also then some final thoughts on what it's been like to work with Above Difference.
Sure. Thank you, Marsha. I think in addition to what Vicky has very rightly articulated, looking at our revised recruitment process, I think what is also fundamental is that where there is any thought at all that an interview process had not been fair, I think very importantly it needs to be raised as a concern. So people who are partners, who are involved in that, need to hear that concern. I think it's very important because sometimes things don't happen the way that they should happen, and leaders are not aware of it, and it becomes a silent voice in the ether, and nothing can be done with if it's not brought into the focus. So I'll say very importantly, it needs to be addressed. I would say as well, looking at the panelists, because I know as an interviewer myself, previously, I've been into a room where I was faced with all white panelists. I felt very nervous, very uncomfortable, because I didn't see anyone that looked like me. And I can tell you very honestly, it did affect my performance from walking into the room, feeling very, very nervous, and I'm thinking, oh my goodness, there isn't anyone here that would understand my cultural perspective, my nuances, my body language, my movement of my hands, my facial expressions, etc. So I felt very isolated and alone. So I think it's very important that there is a look at the panelists to make it more diverse and representative of the service, really, from a staff perspective and also from a workforce perspective. And I think that is one of the significant contributions that Above Difference enabled me as a leader to be intentional about every aspect of my leadership, including recruitment. Because of course, with every action that we're doing as leaders, we are making a statement and we are sending a message across. And we have the gift within us to send the right message from a recruitment perspective, that we are diverse and we are inclusive.
Vicky, just some final thoughts about working with Above Difference and the difference that's made.
So I suppose I can summarize it like this. I have just had a successful bid across Northwest London to have Above Difference come and deliver the one-day masterclasses for maternity across the services, to our band 7s and our band 8s, and our organisation upwards. Our divisional triumvirates and our site teams will incredibly have the opportunity to undertake the programme that I've undertaken. So for me, hopefully those listening that will help you understand the difference that Above Difference has made, because it's not just about, you know, the pocket of the service that I work in and the difference this is making. It's the difference I want it to make to the organisation and every member of staff in our organisation and every patient that walks into our door. And the further the reach, the faster we go together and the further that we go on this journey. And just to finish with a huge thank you, because actually this last few months has given a multitude of skills and abilities that I didn't have before and the team didn't have before, that we are putting to very good use.
So no problem. I'll talk.
Oh, you're on mute, Marsha. Never thought I'd say that to you.
Well, that must be quite delightful to hear. And what are your final thoughts on hearing?
Oh, well, listen, it is delightful to hear. I never got to respond to the recruitment piece, but again, if you are in a trust and you are able to speak to us, get in touch with us. We've done some really interesting work around making sure that that process is inclusive, but with some trust, and seen some dramatic results. But I really love what Rosemary said about do challenge. If you feel that it hasn't been a fair process, then don't just go away and lick your wounds. You know, come back and ask for feedback, find out what it was, because at least even if they don't take it on board, it will make them think about the fact that maybe they need to do things differently. You know, it is one of the reasons we always start working with leaders in organizations. So I think a really important thing for us to take forward. But final thoughts, first and foremost, before I sort of say my final thoughts, can I just acknowledge, Marsha, all the people who have been commenting in the chat function, especially Dede, who said, who expanded it, was my chloroquine in EBA for me, which, yeah, absolutely. So this is taking the chloroquine, and Deborah, who said it was in a spoonful of jam chloroquine. If you don't know the chloroquine thing, go and find out about it. Nasty, nasty stuff. I'd love to acknowledge Marsha Jones, who is here, who was on our last webinar, and who I know does a lot of work to support people, networks, the African and Caribbean midwives, and networks of people a lot across not just the capital, but also across the country. So to everyone else who has commented and been part of that on the chat function, thank you so much. Final thoughts. I would say this, and this, I probably haven't said this as much as I probably in the other 3 webinars, but this is one because I'm not a natural seller, but this is one I would say, if you want to find out about this, if you want the kind of change that you've heard people talk about, then do, I know Nama's put some information in the chat, get yourself registered on the masterclass, or indeed, you know, talk to us about how we can help your organization. Because what makes me so excited about this, I know it's a small part, and don't get me wrong, you know, I'm working with some, you know, Victoria, Rosemary are some exceptionally committed, and the whole Capital Midwife senior leaders I met, some exceptionally committed, talented leaders across the board. And so what we're bringing to the picture is a piece of the jigsaw, but it you know, it means nothing if you don't have the commitment, the willingness, and just the drive to really make inclusion happen anyway. So we feel incredibly blessed to bring our piece of the jigsaw, but it is a piece of the jigsaw that is making a difference. It really is. And this is not just a difference in the number of people coming to a training program. We've been amazed to see how people are able to take these tools and run with them. We know that there's a lot of work that needs to be done across maternity services. We know there's a lot of change that needs to happen. And so if you want to be part of that change process, then come and speak to us about it. Come on the masterclass, find out how you can bring this into your organization and how it can make a difference, or get some of your leaders to speak to us. We're very happy to have conversations with people about the future. But as we come to the end of this final one, I would, before you do it, Marsha, I'd like to say thank you so much to Rosemary and Vicky. You are amazing. It's been such a blessing and a privilege to work with you and your colleagues, and really looking forward to our next sessions, our next few sessions on this journey. And Marsha, just before we do the final ones, 4 webinars you've done for us. Thank you so much in your busy time. Unheard Voice has made, got voices heard over the last month of celebrating our birthday. And, I just have so much respect for you and what you do in this space, in the built environment and in the wider environment, because you're doing exactly what I'm doing in other sectors. And I have an enormous amount of respect for you. So I thank you for being a huge part of our birthday celebrations. If we were in person, I would be giving you flowers right now, but we'll have to wait until we see each other in Derby again.
Well, Jennifer, it's the love is mutual, and I think it only remains really for me to say, well done to you, to Above Difference, to the team. Thank you for the last 5 years, for all the lives that you have touched, changed, transformed, those that you have done so knowingly, and knowing those ripples are unknowing. And very, very many thanks to all of you who've joined this and the last 4 webinars to celebrate 5 years of Above Difference. Of course, just the beginning of its own journey as it continues into the future, continuing to work to support the public services to bring about real change for our wider society. Thank you so much for joining us.